Hi, I'm Dr. Nina. Welcome to the Sarah Connor Show.
Welcome to the Sarah Connor Show.
Welcome to the Sarah Connor Show. It's an absolute pleasure to have you here today. You are, of course, a cosmetic dentist in the new series of Body Fixes. Can you tell me how you first got involved with the series?
Yes, I am. Well, everything happened kind of very randomly. So I wasn't even thinking about doing TV. I never asked to do TV. But what happened? The casting of Body Fixes, they found me on social media, and I had a phone call saying, "Oh, hi, is it the Dr. Nina? Yeah, we've been stalking you on social media." I said, "Okay, hope in a nice way." I said, "Yeah, absolutely." So they asked me, "So we really like your what you're doing, and we would love to have an interview with you." And I said, "Okay, fine, why not?" So literally just happened like this. So I wasn't looking for anything. They found me, and I was like, "Amazing, yeah, I'm in it."
And what was the experience like? Was it different to sort of your daily work? Was it long hours?
I mean, it was completely different from my normal, dentist job. It's like, I was actually shocked how long hours, all the TV world opened up to me, and I was like, oh my God, this is exhausting. I thought dentistry was exhausting, but this, you have to film for so long, and you have to do the same scene for so many times. And I was like, oh, this is just come on, one more time, one more, and one more for the luck. I was like, right. So it was exhausting, but it was really a lot of fun. It was interesting.
You didn't have to do the same procedure on someone 5 times or anything like that?
No, exactly. No.
Did you have a favourite patient that you worked on when you were filming the show?
Yes, favorite patient. It's so hard because I really got so attached to all of them. But I think if I have to pick one, I would pick Raphael, the guy who lost his front tooth when he was 15. Because his sister kindly hit him with a baseball bat. So I know, so he literally wasn't smiling for 15 years, and he's now 30. So, and it was amazing, not just to give him the smile back, but to teach him how to smile. And it was actually quite emotional. We were all crying, and it was really nice.
So your company is called Facial Sculpting. Can you tell me a bit about that? What is facial sculpting?
That's correct, yes, facial sculpting. So the reason why I founded facial sculpting is because facial sculpting is a concept instead of a procedure itself. So because of what I found is that there was a lack of there wasn't really no one that could look at the face and teeth with very high standard at the same time. So whether there were extremely good cosmetic doctors doing just facial aesthetic procedures, or amazing cosmetic dentists just looking at the dentistry. But I wanted to kind of blend my two skills and my two passions together. And so I thought, what I love to do the most is when someone comes to see me, is to assess the whole face and to do a treatment plan that involves both the face and the teeth, because they really go together. You can't really fix your face and then forget about your teeth, or vice versa. They really go together. So they have to be looked at the same, at the same time.
How does it feel to be able to help people and really change their lives and have such a huge impact on them? It's
amazing. I'm really, really grateful, of the profession that I chose, because this is what makes me happy. Is seeing people transforming, not only the smile getting transformed or the face getting transformed, but it's the impact that has on the whole person. So it's the self-esteem that comes from it, it's the confidence, it's the change of job because they finally found the courage to do it. So it's just seeing a person changing so much, and that's so grateful to me. That makes me so happy. So yeah,
that's amazing. So a lot of people might have heard of veneers, but can you explain the difference between composite bonding? What is that?
Right, so composite bonding is a minimal invasive procedure that is getting more and more popular, that basically consists in reshaping the teeth by adding some white resin on top of them. So compared to porcelain veneers, the difference is that with the porcelain veneers we have to file healthy enamel. So it's not minimal invasive, although there are some minimal prep veneers, but still we have to prep and file healthy teeth, healthy enamel. With the composite bonding, we simply can just add the resin and just shape the teeth as we can, as we wish. So aesthetic wise, we've got very, very similar results in a much more conservative way.
That's amazing. So what are your most popular procedures at the moment? Is it kind of like fashion? Do you see certain people coming in for the same things all the time and then something else? Or what are the most popular things right now?
That's a very, very good question.
Thank you very much.
Very good question, because actually, yes, I'm seeing a different, like a change in what I've been asked. So I would say, well, after the Body Fixer show, I had huge demand for composite bonding. So I would say that one of the first, the most popular procedure, so smile design with composite bonding, so whitening and composite bonding. And aesthetic wise, actually, Botox still very, very much so, but more like people are coming for the facial sculpting package. So saying, okay, so look at my face, what can I do to improve? So they literally trust me, and I assess the golden ratio of their face, and I do lots of side profile contouring, so either non-surgical nose reshaping with chin augmentation to correct the symmetry of the profile. So more so what I'm noticed is that people come less saying, okay, Nina, can I please have my lips on? Like, no, people say, okay, Nina, what can I do to improve my face? What's my golden ratio? What's what can I? So yeah, more kind of complex packages.
That's fantastic. And so, of course, a lot of people get Botox and fillers still. Is that something that's particularly painful?
No, it's not painful at all, especially the way I do it. The Botox, I use the smallest needles that you can find in medicine, so it's basically, you feel basically nothing. And filler wise, no, what I do, I numb the area with a very strong numbing cream for about 20 minutes prior to the injection, and yeah, no one ever complains actually, and every single one is scared. Then at the end, I'm like, oh my god, that was it, I felt nothing. So no, it's absolutely very much bearable.
Okay, because sort of certainly, I guess in the 90s and early noughties, there were lots of high-profile sort of celebrities getting Botox, and then sort of things went wrong sometimes. And what tips would you give to anyone that wants to get fillers or Botox, and how can you sort of avoid similar things going wrong?
Another very good question.
Thank you again.
So, right, absolutely. So, very, very important. The first thing is to check whether the practitioner that is going to inject in your face is either a doctor, a dentist, or a nurse prescriber. First of all. Second of all, ideally, you want to check that your doctor or dentist is part of Safe Face, and which is this group of doctors and dentists that we have been tested so strictly to be part of the Safe Face, which guarantees you guys, the public, the fact that you are in very safe hands. And then just ask lots of questions. Try to I know it's very difficult. I always say to my patient, please don't go Dr. Google because it's just the worst thing ever. But at the same time, try to educate yourself on very trustworthy resources like PubMed, WebMD, so you kind of know, and ask question, have 2-3 consultation before letting anyone inject your face, which is there 24/7, you can't escape it. Make sure you go to the right person, so you not only have to be in safe hands, or you have to like the person, or you have to connect. So go to someone that listen to you, because I got so many of my clients say, oh my god, you listen, you give me options. So just make sure you feel comfortable, because if something goes wrong, then it's there all the time.
That's really good advice. Now, I was having a bit of a look on your website, and there's lots of interesting procedures listed. So I was wondering if you could sort of shed a little light on some of them. So the first one is IV vitamin drips.
Yes, so that's an intravenous drip, which we do for different reasons. One of the most popular IV drips that we do is just to give energy back. So it's a cocktail of vitamins and antioxidant, which make you feel amazing, especially if you've been going out and you're hangover. Just help you to recover very, very quickly, and also it's a very good way to kind of combine with all the facial procedures, because that will help me to literally load your body with antioxidant, which has a great effect on the skin as well.
That's very good to know. So after New Year, I'll definitely be coming to visit for that one. The next one is, so can you get Botox to actually stop excessive sweating?
Yes, that's correct. Isn't it amazing? So very, very popular around like April, May time, because really what happened, the Botox can also have effect on the glands that produce the sweat. So what we do, we inject the Botox under the arms. I've got a couple of really bless them patients that I have to inject in the palms of the hands, because they have got really my auntie actually, she's really, really bad. So it works really well. It's quite painful on the palms, not much on the underarms, but it will reduce the sweating massively. So must do before the summer.
Wow, so I should bring some of the people I was sitting there on the tube earlier on.
Bring them to me.
So the next one is fat dissolvent.
Yes, very popular as well. So it's called, the trademark name is Aqualex. It's an acid that very natural, because we have in our body already, in our stomach, to digest the fat. So what we do, we simply inject that fat where we want to dissolve the fat in places that we don't want the fat. So like the area that no matter how much you exercise or you diet, but you just cannot get rid, which normally is the bingo wings, stomachs, or double chin. Amazing. And what it does, it literally dissolves the fat cells. So unless you put on weight again, the fat goes.
It's quite incredible. And then so the next one that sounds interesting to me is, what is microneedling?
So microneedling sounds like a torture. It's like a demo roll or demo stamp. So either looks like a roll or something like square with lots of needle inside, and it looks horrendous, but it's actually not painful, because obviously we numb before.
Hello.
Hi.
Welcome to the Sarah O'Connell Show.
Join us. And what it does, it stimulates the collagen production from underneath. So what I love to do, normally I use it with growth factor serum. So I stimulate with the needles, I stimulate the production of the collagen, and also I make sure these growth factor serum penetrating in the skin to give an even more rejuvenating effect.
That's incredible what you can do these days, isn't it?
Goodness, can you imagine how I look without all those things? Like, I would look like so much older.
If you did the fat dissolving on me, there'd be nothing on me left. I'd just be a puddle. So finally, have you got any messages for your fans and people watching the Sarah O'Connell Show around the world?
Okay, so I would say, guys, thank you so much for watching this amazing Sarah show, and for everyone that's been watching me on Body Fixers, thank you so much for watching me, for supporting me, and for the messages, the nice comments that you send me. And I promise that if you send me an email or a message on Instagram, I'll reply to everyone, I promise.
That's fantastic. Well, it's been absolutely fascinating and lovely to speak to you today. Thank you for coming on the Sarah O'Connell Show. To everyone at home, thank you for watching. Be sure to share, subscribe, give the video a big thumbs up, and I'll see you all again soon for another episode of the Sarah O'Connell Show. Bye.
Bye.